Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Newspart interlude. This audio podcast as part of a Storm and Squala, and this audio podcast as part of a Storm Robotics production. A sort of an excerpt looking at looking at looking at works looking at works or is part of works in regards to pediatrics and young people and those suffering with varying forms of chronic kidney disease or CKD. So there have been several publications that give insight into assessing quality of life or QOL in and of young people in and of young people. However, the context surrounding well-being to support young people with CKD or in around suffering with CKD or varying forms of CKD pre sort of pre and also post transplantation has not generally been investigated. Coping or well-being, for example, can include managing symptoms, undergoing invasive forms of treatment, tolerating pharmacotherapy, tolerating pharmacotherapy, and in regard to varying appointments. Relating and regarding to some works from around 2016, authors had informed of varying themes amongst works and barriers to the understanding of well-being in young people with CKD can include where there is a perception that CKD only occurs in the older population, when clearly this is not the case. Investigators had identified that research or investigations need to concentrate or focus on around pediatrics and young people's ability in around well-being at different and amongst around different and amongst different ages and in line to cognitive development. And so in around cognitive development, and where cognitive development can differ across varying age groups. In context of service provision, a sort of coping construct or even a well-being construct has not been evidenced, has not been implemented. Renal pediatrics on those pediatrics or young people in line to nephrology or renal around renal practices face varying challenges surrounding renal kidney disease, which requires a multifaceted can require sort of a multifaceted uh, can require multifaceted therapies or pharmacotherapies, and also dealing where young people having to deal with symptomologies aligned to varying morbidities or comorbidities. So CKD has an impact on amongst healthcare service users, and patients tend to deal with patients tend to deal with sort of the deal with sort of the sort of challenges in amongst long term in a long term in a long term in around in sort of the long term. So well-being or even coping is a sort of a sensible response to regulate the effect of different types of life stresses. In more recent works or research, patients or healthcare service users with renal insufficiency experience anxiety sort of 5 times more than the general population. The prevalence rate of anxiety related symptoms or symptomologies are identified in just over 22%, whilst the prevalence rate of anxiety was estimated to have been estimated between 12 to 52% and particularly in end stage renal disease or end stage kidney disease, ESRD or ESKD. And the varying sort of the varying the varying im- the varying sort of varying sort of initiatives from healthcare service providers fluctuates in the CKD or chronic kidney disease population because of the overlapping symptomologies because of the overlapping sort of symptomologies. There is an association between sort of aspects of anxiety and also reduced glomerular filtration rate estimated glomerular filtration rate or EGFR EGFR in amongst evidenced literature. That draws this audio podcast to a close. This audio podcast as part of a Newspart Interlude. This audio podcast as part of a Ztorm and Squala, and this audio podcast as part of a Ztorm Robotics production.